How does chronic raw inflammation cause anxiety disorders? Imagine living with constant pain, fatigue, and the worry that your symptoms might worsen at any moment. Rheumatoid arthritis is more than just joint pain. It's a long-term condition that can also affect your mental health, especially leading to anxiety. To understand how this happens, we need to look at both the biological effects of inflammation and the emotional toll of managing a chronic illness. When rheumatoid arthritis flares up, it causes your immune system to produce high levels of inflammatory molecules called cytokines. These include tumor necrosis factor alpha, interleukin-6, and interleukin-17. While these cytokines are essential for fighting infection and healing, in raw they stay elevated and can cross into the brain. Once there, they can influence how brain cells work, especially those involved in controlling mood and emotions. For example, cytokines can interfere with neurotransmitters like serotonin and dopamine, which are chemicals that help regulate feelings of happiness and calm. When these chemicals are out of balance, it can lead to feelings of anxiety or depression. Chronic inflammation can also activate the body's stress response system, known as the hypothalamic pituitary adrenal axis. This system releases stress hormones like cortisol. When cortisol levels stay high over time, it can disrupt your mood and increase feelings of anxiety. Research shows that persistent inflammation may also affect brain areas like the hippocampus, which plays a role in emotional regulation. Changes in these brain regions can make a person more prone to anxiety disorders. But inflammation isn't the only factor. Living with RA involves dealing with ongoing pain, limited mobility, and unpredictable flare-ups. These physical challenges can cause significant psychological stress. The constant need to manage treatments, appointments, and the fear of disease progression can make anxiety worse. It's common for people with RA to also experience depression, and having both conditions can create a cycle that worsens overall mental health and quality of life. Managing rheumatoid arthritis effectively involves more than just controlling joint inflammation. It's important to address mental and emotional health too. Strategies like stress management techniques, counseling, and support groups can help reduce anxiety. Staying in close contact with healthcare providers about both physical symptoms and emotional well-being is key, because mental health issues often go unnoticed or untreated in chronic illness. The scientific community agrees that inflammation plays a role in the development of anxiety in RA, but the exact pathways are still being studied. Each person's experience can be different, and many factors contribute to mental health. What's clear is that treating RA successfully involves caring for the whole person, body and mind. If you or someone you know is feeling anxious, reaching out for professional support can make a big difference. Remember, managing inflammation, staying active, and seeking emotional support are all important steps toward feeling better both physically and mentally. Always consult healthcare professionals for personalized advice, and know that addressing mental health is a vital part of living well with rheumatoid arthritis.